how to pass the knife to the operator. She's the operator. Now I'm an assistant. So when the operator open the hand arm like this, close the forefinger, close the arm up like this. So when I pass the instrument, can I pass like this? Because the operator all the time he will concentration on the operation abdomen, something like that. Maybe the liver, maybe the spleen and bladder. So he will not to see what the assistant will give me the instrument. I just say knife, scissors, on needle with a suture, something like that. So assistant will pass the instrument to the operator. Be careful, the assistant, you hold the sharp margin outside your hand, not inside this one like this one. Hold like this and pass this holder to the operator hand and will leave. If pass like this, because the operator, she's not attention on this side. So when I pass, he will close, will cut the hand of the operator, will damage by himself. Yeah? So we'll pass this one. And if I hold the instrument and knife, the sharp margin inside my hand, the instrument maybe will cut my finger. So be careful when you pass the instrument. Don't injure the operator and yourself. This one's the knife. The same, pass the needle holder and also like this. Go and take out. And never to pass like this. The needle will puncture the operator hand. This is simple, like the patient's body. Like the patient body. This is the patient's head and his neck. The incision. Maybe in the next class, I will teach how to stitch, and the different times of the stitch. And you see like this. Okay. The other instruments we call this one called forceps. But this surgical forceps is very totally different restaurant forceps. The brand end is outside your hand, like this. Usually use 3 finger thumbs on the one side. The same, there are some mark here. Yeah. So one thumb in this side, and the other side is index finger and the middle finger. And these 2 fingers we can hiding inside it. So use this forceps to clamp for the tissues or maybe some blood. You can try to clamp this one to clamp sharply to the sutures like this. And use the other hand, use the scissors to cut. Open the scissors, small open, small mouth open. This is for forceps. Okay, now how to use both hands cooperatively to do the stitch. The forceps also they have 2 kinds. Forceps without teeth. This one, can you see that? They have some teeth in the end. The forceps with teeth can only use the skin, tender, and this one, forceps without teeth, we can clamp the vessel on tissues. Keep in mind, be careful. Never use the forceps with the teeth to hold the vessel, the livers and bladders, gallbladders, spleens. Never use the forceps with the teeth. And this, the operator, you should know this one. And also, as the assistant and the nurse, when the operator say, give me the forceps, you should, assistant should look at the operation, what the tissue, what the organs the operator is going to do. So never pass the forceps with the T to the operator to hold the intestine. Otherwise, use this instrument will puncture the intestine. Before I say, this is the needle, and use the needle holder. When you stitch, rest the suture between the cramp, and use forceps. Hold the skin one side of the intestine. So we stitch one side and go the other side, hold, come out, and use the forceps. Just hold the needle. Don't need to use the forceps to move the needle. Just hold and use the needle holder to move the needle. This hand, you use the needle holder to move out the needle. The arm is down like this, not used like this. So the arm is down like this and cramp and go out. And so just trace your hand. And after the needle outside the skin, left hand, hold the forceps inside the palm and use 2 fingers to hold the needle with the suture. See, use the 2 fingers to hold it. Not only hold the needle, if you only hold the needle, when you move, the suture will go out. And also not only hold the suture. If only hold the suture, the needle will move a lot. Yeah. And this is we call the forceps. And some retractor. And when doing the operation, because incision, like abdomen, we only do small incision. So how to see inside, maybe the tumor inside, very deep inside, we need to put in a retractor to hold the intestine apart so we can see inside. There are different kinds of the retractor. When you go to the operation theater, the teacher will show you. I will show you. Today I'm not showing this instrument to you. And next, I will teach you how to tie. Can you get a suture like this? At least 50 centimeter long suture, like this. The sutures, left hand take a long part suture. The other side is left short. This tying knot we call single hand tying. Short sutures is upside, and long is down here like this. And the right hand use the thumb and the middle finger, the end of the middle finger, holding the short segment of the suture. Left the 2 centimeter here. Don't leave too long, and don't leave the too short. If too long, the long suture, when you tying, the end of the suture will tie inside the knot. If too short, when you move the finger, the suture very easy to lose. Yeah? Okay. 你就保持不动啊。Left hand hold this long suture. Maybe if a suture with the roll, it's okay. You take the roll in your hand, and then use right hand hold the short one like this, middle finger, and left leave the index finger like this. From the up part of the suture, go up. Leave the long sutures down like this. Hold this and use the index finger to hold the long part of the suture. Go like this. And take a index finger to hold the suture up and release the thumbs and middle finger and go up to hold the suture. Already the short part of the suture through the rings, make a note here, make a ring here. So it's going into the ring. Now use the thumb and the index finger to hold the suture like this. And left pass is go up. Right hand use the middle finger to push the short part of the suture to the node and finish first type. Everyone try it again. Hold the short part of the suture with thumb and the middle finger. Try to hold the suture with your end of the middle finger. Don't hold like this. If you hold like this, you move the spaces inside the spaces very become small, and then you very difficult to hold the suture come through the ring. Use the end of the suture, the end of the middle finger and the thumb, and use the index finger touch the long part of suture and hold the short suture up. Is up. Left is up. And release middle finger and the index finger. And thumbs with the middle finger to hold the suture. And left hand is up. And right hand is down. Use the middle finger to push. Finish one. 用这个，还是用这个哈 ？It's better use this 角度。Right hand is short part, long. Left hand is long segment of the suture. And middle finger and the thumbs hold short suture and use the index finger to hold the short segment of the suture, and when it turn up, the face of the index is up, and release the thumbs and middle finger. Once more. Go up and release, hold the suture with thumb and the index finger. And this time, did you have to see that the suture, the short end is up your finger. When you hold suture, this part of the suture is down like this, down your finger. And when you come up, hold it, the second part, index with the thumbs, the suture, the end of the suture will be like this. And left hand is up, right hand right hand use the middle to push this finished first note.